Hello and welcome to Healthcare Insights. Since this is my first show, let me introduce myself. My name is Hamid Mahmood, and I've been working in the U.S. healthcare industry for over 20 years now. I've worked at large commercial health insurance companies and for large global consulting firms, and also for state departments of health and CMS. All of my work has been in healthcare technology, business, and strategy consulting with a focus on how to make healthcare better for consumers. The whole purpose of coming up with this channel is to allow me to openly discuss issues with the U.S. healthcare system and how we can potentially overcome these challenges with solutions using modern technologies. But let's get to the first topic, which is, for today, autism and mental health, and the related challenges in the U.S. that are being faced not only by individuals that are suffering from these diseases, but also by the caregivers, the parents, and other family members as well. The prevalence of autism spectrum disorder, or ASD, in the United States varies across age groups. According to the CDC's Autism and Developmental Disabilities Monitoring Network, about 1 in 36 children aged 8 years were identified with ASD in 2020. Additionally, ASD is reported to occur in all racial, ethnic, and socioeconomic groups. Autism prevalence has shown a significant increase over the years, largely due to improved diagnostic practices, greater awareness, and evolving criteria. In 2020, the prevalence was approximately 1 in 36 children. This upward trend highlights the importance of early diagnoses and intervention, as well as the need for resources to support individuals and families navigating ASD. Autism prevalence trends in the U.S. show variations across racial and ethnic groups, as well as demographic factors. Here are some key insights. For example, racial and ethnic disparities. Historically, Caucasian children have been diagnosed with autism spectrum disorder more frequently and earlier than children from other racial and ethnic groups. However, recent efforts to address the healthcare disparities have narrowed these gaps. Gender differences. ASD is nearly 4 times more common among boys than girls. Socioeconomic factors. Access to diagnostic services and resources can influence prevalence rates, with underserved communities often facing barriers to early diagnoses. At the end of the day, ASD, autism, affects millions of people across the U.S. This is very personal to me, as I'm responsible to take care of an individual and loved one that has been diagnosed with autism, although on the milder side. I have firsthand experienced the challenges that I'm going to talk to you about and how I believe we can make a difference. The first issue, as it relates to autism and/or any mental health condition, is the timely and early identification and diagnosis. And I suffered at the hands of the primary care physician, where I was taking my loved one because they failed to identify speech delay as an important factor in referring us to a specialist who could then be able to identify the root cause and diagnose the disease. This resulted in approximately a delay of 6 to 8 months in diagnosing and identifying the disease. This needs to be avoided at all costs for every family in the U.S. There's an anomaly. Anything out of the ordinary. If there's an issue, it needs to be highlighted and the parents need to be referred to a specialist at the right time. But the question is, how can we solve for this problem of identifying these issues, these anomalies at the point of care, alert the doctor, and have them refer the patient to a specialist for further evaluation and diagnosis? That is the big and main question. I'm now going to talk about a potential solution that I'm recommending that the industry/companies need to create with the use of AI and other modern technologies. Once created, this solution can then be implemented within large electronic medical record systems and across doctors' offices and hospital systems in the U.S. Think of it as a smart doctor's assistant. The first step is to create an AI-based model that would look across historical claims, clinical, and other historical EMR data to pick out overlooked anomalies, things that are out of the ordinary, that were reported during a visit to the doctor's office, but no action was taken by the doctor to address it, and then tie them to a later diagnosis of autism in the same individual. For those that do not know about the data sets I mentioned, when you go to see a doctor, the doctor uses an electronic health record system to input information about the visit. It captures the discussion between the patient and the doctor, which includes symptoms, diagnoses, any advice given by the doctor, and any medications prescribed to the patient, and any referrals given. This record needs to be maintained by all doctors' offices. Back to the model. This model would look through multi-years worth of data and detect the anomalies and tie them to a later diagnosis of autism. And this model would need to be monitored and trained by doctors and experts in the field of ASD. Once this AI model is trained on historical data, it then needs to be deployed into a real-world pediatrician office. The placement can be as an add-on to an existing EMR or standalone. This solution has 2 components: a tablet on which the AI model is loaded as an app, and a connected listening device, both placed in the physician's office. This would allow the conversation between the doctor and the patient be analyzed in real time by this AI model trained on historical data. As soon as it hears a condition, an anomaly that has been overlooked by the doctor, and or the doctor fails to address it, the AI model would highlight for the doctor the anomaly detected and recommend that a referral be made to a specialist for further evaluation. No time wasted. Detected and referred to at the point of care. Now, a lot of my friends listening from consulting firms, health tech firms, and others may ask, why? Why should any company invest in a solution like this? The answer is very simple. Early and expanded detection of autism will lead to better and improved outcomes for the affected individual. This will then lead to an overall reduced cost of care over the lifetime for the affected individual, family, and the healthcare payer organization. Remember, the key metrics: improved outcomes and reduced cost. Again, no one has done this yet in the industry, but I'm sure someone somewhere is thinking about it. If you would like to discuss more or need additional advice, please feel free to reach out via the contact information provided. Now I want to move to a second part, which is equally important, which I am terming as collateral impact. Since I've experienced it firsthand, I know is a huge challenge for families that are impacted by this disease. Remember, ASD doesn't just impact the individual, it impacts the entire family. If it's one child that has been diagnosed and it's a family of 4 that includes both parents and one additional sibling, then all 4 of them are impacted. The parents, their relationship strains because it becomes a shared additional responsibility to take care of the individual suffering from ASD. Imagine doing that 5 days a week and more. The toll is significant. All of this leads to an imbalanced family, rampant with frustration, anger, dismay, fear, and causes people to lose hope and forget about providing the right care, the right level of care to the patient. Additionally, on the flip side, people focus so much on providing care to the individual that they do not focus on their own care or on their own health. This then leads to further issues because mental health issues also then start to show up in parents and other children, including siblings. This also includes depression and anxiety, 2 very important and very prevalent mental health disorders. Now, parents are always concerned and thinking about what is going to happen to this child of mine. Is this child ever going to heal? Are they ever going to be able to talk? Are they ever going to be able to draw like other kids draw? Will all these therapies work? What I believe, the holistic impact of taking care of an individual with ASD, you have to talk to other people. You must talk to experts. You must talk to people that can help you heal. Because if you, as a caregiver, as a parent, or as a sibling, are mentally disturbed yourself, you will not be able to provide good care to the individual suffering from ASD. The entire family will continue to be impacted. Your mental health as a parent or as a caregiver also matters. Your mental health comes first. That's why when we start talking about providing care for people suffering from ASD, we don't have to just think about the individual. We have to think about the entire family that is affected. Currently, all the services that are provided just for the individual and are mostly covered by state. That's why when you think about providing care for an individual suffering from ASD, think about providing care to the entire family. That is the difference between health insurance and health care. Now let's talk about another important part, which is what happens after the diagnoses, especially for the parents. The doctor, after making the diagnoses, will prescribe services. That's it. Cost of care for families is a huge issue. Who will pay? Reality is, state Medicaid would cover all the costs associated with ASD, but the parent does not know that. Reality is, parents struggle to find what to do next after the diagnosis. So from our friends in health tech, consulting firms, healthcare startups, you would want to listen up to this next part. I would like to propose a solution that includes a very simple mobile application platform that can be downloaded by parents across the US. They would be able to input some basic information as well as upload the diagnosis documentation to the mobile application platform. The mobile app would provide them with the step-by-step guide on how to first enroll in their particular state healthcare Medicaid program so that the first burden of the cost of care is completely taken care of. Once that's done, the mobile application will help them find caregivers or caregiving organizations close to where they live and connect them with those organizations. Through the same mobile app, they will also be able to share the diagnoses, which would allow the caregiving organizations to be able to review the diagnoses in depth and come up with a complete therapy program for such individuals, minimizing multiple different visits, multiple different schedules, and multiple different times. The parents will have access to the care protocol assigned by the caregiving organizations for things such as occupational therapy, physical therapy, ABA, speech therapy, and others, and be able to see the progress of their child against a set of milestones across each of these therapy areas. The mobile app platform We'll also be able to connect parents with caregivers and really create a circle of care around the individual, all focused on making sure that the individual receives the best care possible and it's measurable. This will allow people from around the globe to come together and discuss their ideas, their therapies, and everything that's working for them. I know this is going to sound a little out there, but this can also be used as a platform for global organizations to be able to provide therapy to kids in the US at a much lower cost using the telemedicine platform. I've done it, but instead of using a telemedicine platform, we use WhatsApp. The therapist would get on from a different part of the world at a set time every day, and they would guide us through a series of tasks and exercises that we would need to perform with the individual. In this case, my loved one that's suffering from ASD. And we could see a dramatic improvement in the individual while we went through that therapy, while we went through that session. Again, this can potentially open doors for global collaboration and global engagement, and we need that. However, if we make this a solution, or if we make this mobile app platform a downloadable application that anybody can download globally, it becomes a business-to-consumer solution with a global market and allows it to be a profitable solution for any organization willing to invest in it. People need guidance. People need support. People do not know what to do next. So while this solution may start within just the US, it can go global into other countries and guide people to the resources that are available in their country to be able to help with their children. Again, something to think about, something to think through. Obviously, this is my perspective, and this is just a potential solution that I have come up with. What are your thoughts? Do you feel this is viable? Do you feel this is feasible? Would love to hear your thoughts. Please go ahead and tell me what you think in the comment section below. If you disagree, please let me know. If you agree, please let me know. Thank you for your time today. And if you liked the video, please go ahead and hit like and subscribe and share this video with others. Thank you for your time.